patients really should need to lose 25 or more pounds. There are plenty of patients and plenty of providers who are doing patients that have 15 pounds to lose or whatever. It's considered off-label to use and treat a patient with a lower BMI. Couple of things, they really should be healthy enough. You don't want to deal with somebody who needs a lot of individual coaching or somebody who is going to need tons of hand holding. We all know who those patients are. If you've got people with multiple comorbidities or people who are having a hard time even walking because they're really unhealthy, you probably should refer them out. Not a great fit for the program because they're gonna be harder to work with. No restricted conditions or health history. So make sure that you are avoiding patients who, have a history of pancreatitis, eating disorders, somebody who is a daily drinker. I mean, really just screening your patients appropriately. No history of significant mental health issues. No personal family history of medullary thyroid carcinoma or patients with multiple endocrine neoplasm syndrome type 2. Really no pregnant or breastfeeding patients. If they're diabetics, have them contact their doctor. Past history of suicidal ideation, suicide attempt, uncontrolled psychiatric disorders, any known allergies, of course, to the GLP-1 medications, or, as we said before, pancreatitis, alcohol abuse, renal impairment, liver failure, stuff like that, right? Really, BMI of 30 with comorbidities, or a BMI of 30 or a BMI of 25 plus some kind of a comorbidity like diabetes, prediabetes, hypertension, PCOS, high cholesterol, cardiovascular disease, sleep apnea, those kinds of things. Everything else, you're just know that you're prescribing off-label. So the intake, we already kind of discussed this, but it takes about 45 minutes. You can do it individual when you're first starting. You can do it with a group. A lot of it is just education, right? You're explaining the program, you're explaining how semaglutide works. You're going to teach them how to do the injections. You're going to dispense the medication. You're going to go over the contract, right? So we have a consent that also is a contract, and it basically says that they understand that we are dispensing a medication that is not the FDA approved drug, Wegovy or Ozempic, but it is a compounded version of the ingredients that are in there, right? It goes over things like they won't share their medications with friends, that we have the right to stop prescribing to them if they break the contract, that they can't change their dosage schedule or things like that, that they won't stop or start medications without communicating with us. So we go over all of that, and they have to sign that. Don't do the injections in the office. I've seen a ton of providers that just have people come in for a shot, and it's how they're able to offer like these upfront like $50 a week type options. But for most people, they're actually breaking the dispensing laws. The most pharmacies are providing patient-specific labels or medications. So the vial that comes for that patient needs to go with that patient. Your license is not worth making a couple extra bucks, right? And really, I mean, patients are going to use a single vial for 3 to 4 months. So there's no reason for them to have to come in every week. First of all, that requires, a staff member designated to giving those shots every week. But overall, people are going to do just fine doing their injections at home. So you're going to charge upfront for the whole program, whether they finish it or not. They pay up front. They're getting access to you, your resources, all of the stuff, and the medications. Once the medication is dispensed, they can't bring it back, okay, because it's patient specific. They know that before they go in. Some people are like, oh, I could never inject myself. Even the patients that are super needle phobic do just fine when we teach them how to do it correctly. You're going to decap the bottle so they're not drawing through the stopper and dulling the needle. You're going to have them use a tiny little insulin syringe. They're going to pinch the area hard. They're going to inject. They'll let go of the skin and withdraw the needle. They will barely feel that when those things are done. When doing large groups, it really simplifies the tracking process, and you can create a Facebook support group if you want to. The same group of people can come in for their check-ins. It actually creates a nice little community aspect if you do like these big group settings. Make sure that you're going to take photos during that as well, and all of their measurements. Everything gets done. They go home with meds, syringes, sharps, a sharps container, alcohol. You'll teach them and they'll take the first shot there. So as part of the intake process, we educate the patient on what it is, how and why it works. We're going to teach them. We send them with all of the information at that first visit, and then we refer back to that information over the next 90 days. You can even create little emails. You can send out little posts. It can be part of your text messages, or have a Facebook group where your people are going through, and you can just remind them about the little pieces of the information, such as making sure they're getting enough protein, refreshing them on water requirements, especially when we're going into hot months, making sure they're getting enough hydration, movement recommendations, most common reasons that patients are stalling out on their weight loss. One of the things that we do is we go over what it is and how it works. And, for example, semaglutide is a simple once-a-week weight loss shot. It does 3 things, right? The first things it does is slows your gastric emptying so you're not hungry, right? And you fill up faster and it stays in your system longer. Second, it shuts down ghrelin, which is the hunger hormone, right? It's going to, ghrelin gets out of whack when we are under long periods of stress, and it is going to drive you to eat more calories than your body needs. And then finally, it acts like glucagon. Well, glucagon's a hormone that gets released from the liver when you're doing long bouts of physical activity. It's what keeps you from starving to death and dying out in the woods if you get lost for 3 days. Because it gets released from the liver, it goes out and it breaks down your stored fat for energy. So ultimately, you are eating a low-calorie diet. You're focusing on protein and veggies. And as you're doing that, you're protecting your muscles so that your body's not under stress as it's losing weight. It's going to go out and it's going to break down that stored fat for energy. And those are the things that we talk about and remind them of as they go through. Because some people would be like, oh, if I'm not eating, that's bad, right? And I think without the right guidance, they're absolutely right. I mean, we're seeing an uptick in people complaining about, muscle wasting and things like that. Or we've all seen incidences where people are doing these crazy calorie restrictions and they're losing their hair like crazy. It's super important that your patients are getting enough protein and the right kind of veggies and the nutritional guidance to ensure that they stay safe as they're also hacking their body's natural capacity to use this medication effectively, right? So we will give them the breakdown of those things with both semaglutide and tirzepatide, right? Both wonderful medications for people who tend to struggle with some of their, every once in a while you'll get a patient who is has a little less effective response with the semaglutide. That's where a lot of people are switching over to tirzepatide, and it's creating some pretty good improvement. So they get overall better results. People also want to know, how long am I going to need to take it? The short answer is, on average, most people are going to lose about, 8 to 15 pounds a month. we want them to lose it over a period of time. So I usually tell patients, plan to be on it 3 to 6 months. It takes a while for that set point to reset. And really, most of my patients, even when they hit goal, we will have them stay on for another couple months and we'll do the titrating process. So I just tell people, plan to stay on it about probably 3 to 6 months on average. How is it administered? We teach them all about the weekly shot. We show them how to do it. Talk about the most common side effects. And really, the most common side effects you're going to see are nausea. The potential for constipation is high. People get heartburn, things like that. There are serious consequences and serious side effects, but by appropriately screening your patients, you are less likely to see any of those. I tell patients they can't drink alcohol, right? You can either drink or you can lose weight. You cannot do both. So if you have somebody who's a daily drinker, they're at higher risk for pancreatitis just specifically because they are daily drinkers, right? So we talk about serious side effects, potential side effects, typical dosing schedule once a week. There are times where patients will have a trip coming up or they'll miss a dose or whatever. Those dosing schedules can be moved around a little bit, but also talking about, who should avoid it. And also we just tell them, we're cash pay practice. It's not covered by insurance. If you think you qualify for insurance coverage, I recommend you follow up with your doctor, right? So why we need the diet and intermittent fasting. This is important. So glucagon's role in the body is to prevent your blood glucose levels from dropping too low. Okay, so it works on the liver in a couple of ways. It stimulates the conversion of stored glycogen to glucose, which glycogen is stored in the liver, and it gets released into the bloodstream. This is glycogenolysis, right? It promotes also the production of glucose from amino acid molecules, and this is like the gluconeogenesis. It reduces your overall glucose consumption by the liver so that as much glucose as possible can be secreted into the bloodstream to be used by your body, right? By all the cells. The other cool thing it does is it acts on the adipose tissue to stimulate the breakdown of fat stores into the bloodstream. So release of glucagon is stimulated essentially by low blood glucose, protein-rich meals, and adrenaline. Okay, so that's the key. Low blood sugar, protein-rich meals, and adrenaline. So the release of glucagon is essentially prevented by raised glucose levels and carbohydrate-rich meals. And so if you want to take advantage of all of the natural body's way of working, you can essentially hack and create much more efficient and better weight loss by having a high protein diet. First of all, it also protects your muscles, right? Low carb, which means no booze, because what does alcohol break down to? And periods of calorie deficit overall. It's going to just help the medication work the most efficiently to break down all of your stored fat for energy. So because of that, we recommend intermittent fasting, low carb diet, no alcohol, and high protein. So tips and tricks for success. This is what we tell the patient when we're doing the intake. I say, take your shot in the evening, same time, every single week. We have them take a Zofran 30 minutes prior to the shot just to reduce the potential for nausea. I have them take it at night because if somebody is kind of sensitive and they have a little bit of nausea, it's usually in the first 24 to 48 hours, right? So if they take it right before bedtime, they're going to go to sleep. They're probably going to sleep right through it if they have any issues. Maybe they'll take a Zofran in the morning too, but most people will just do, a single dose of Zofran, or they'll be just like, I've never really needed it. Every once in a while you have somebody who's super sensitive. But we want them to have what they need at home. So you're going to prescribe it. They're going to take their first one at the office, right? Have them drink a minimum minimum of 64 ounces of water a day. On a hot day, they need to be drinking so much more. We're heading into summer, so heading into summer, we know that they're going to be, that they need to be drinking more. It's going to prevent constipation. It's going to help their body flush out toxins. In the first 2 to 3 weeks, people are going to be more fatigued. They're going to feel kind of funky. And some of that has to do with, the fact that our bodies store our toxins in our fat cells. So they're going to be a little bit more fatigued. The other thing is they need to stay super hydrated because it's going to help flush out all the toxins. It's going to help prevent constipation, but it's also going to protect their kidneys. Sometimes when people aren't hungry, they also aren't thirsty. So we actually send our patients home with a water bottle, right? It's part of their process. They get in their intake stuff. We give them a fancy little water bottle. This one here is branded. Let's see. Oh, yep. It's hard to see, but ours is branded for us, but it's enough that I'm saying you need to drink two to 4 of these a day minimum. So in the winter, minimum of 2, it's 80 ounces. And in the summertime, I'm going to have them drink more, right? Intermittent fasting is ideal when on a GLP-1 medication. Those who opt for intermittent fasting, 8 hours to eat during the day and then 16 hours on, they lose more weight. So I say pick whatever 8 hours is going to work for your schedule. For me, it's between 12 and 8. And here's the thing, if you establish these patterns and you maintain them, you will be able to maintain your weight loss when you're off the medication, right? That is the tip and the key for people to maintain success over time, right? So we are using semaglutide or tirzepatide as a tool. It is a tool to assist people to rapidly lose weight. The underlying habits and lifestyle changes that we are instilling in the patients needs to happen as well. So we want them to do these things now, and we also want them to maintain them. It's always a good idea to be really well hydrated, right? It's always a good idea to eat intermittent fasting. It's good for our body for so many different reasons. Avoiding alcohol as much as possible. Specifically while you're on the program, you can either lose weight or you can drink alcohol, but you cannot do both, right? So if you don't want to stop drinking, you shouldn't do the program. You're also at a higher risk of pancreatitis. So, of course, there's going to be somebody that's going to be like, it was my birthday, and they'll see it reflected on the scale. It won't move that week. So, I still am not drinking alcohol. Maybe every few months I might do something at the winery or whatever, but it's still minimal. Low carb diet is ideal to maximize your nutrition and accelerate the weight loss program, right? Prioritize lean proteins, vegetables, some fruits, seeds, good sources of healthy fats, high carb diet, and that should help increase your weight loss and also reduce GI symptoms. People that are eating a lot of carbohydrates, they just sit in the gut and they get broken down and they release all kinds of bacteria and they just feel awful. So remind them that it's just going to sit in your gut. It's going to make you feel sick. So avoid the carbohydrates when at all possible. Also, they're going to fill up faster, right? So if you eat a couple bites of rice and then you're full, you're in a rough position. You're not going to get enough protein. Your body is not going to be happy, and it's going to stall your weight loss. A high fiber diet, so loads of veggies, or a fiber supplement such as like your psyllium husk, and that you can take, regular psyllium husk or Metamucil. It's going to feed and repair your gut biome. It's going to assist you in constipation or diarrhea, right? It also helps lower cholesterol over time. And you are going to have a patient here and there who is hungry when they first start. So if they're hungry before noon or whatever their eating window is, if you have them take a fiber supplement, it's going to fill them up and they'll stay full longer. So it's my little tip and trick for multiple things. It just keeps things moving. It's going to be good for you overall. And if you tend to be hungry before it's time for you to eat, having a fiber supplement is super helpful for that. Keep stool softeners, Miralax. You have to have Miralax on hand. I always say if you aren't having regular bowel movements, then you need to have this on board, right? If you wake up and you're day one, no bowel movement, you start on your Miralax. If you don't have a bowel movement the next day, it's Miralax AM and PM. And then on day 3, if you still haven't had a bowel movement, it's every 4 hours until you achieve a bowel movement. Now, I've had several hundred patients come through my program, and there have been 2 who had challenges beyond that. You can have them take the magnesium citrate. That'll oftentimes get things moving. I have one patient that had used a suppository, and that was what needed to happen. Do not let these people get constipated. You can hold, 4 to 6 pounds of poop in your body. You're going to feel kind of rotten, and when you finally have to go, it's an incredibly uncomfortable experience. So make sure that you push the fact that they need to really take care of their bowel health, because constipation is probably the most common thing that people struggle with. I've had a couple of patients that have had diarrhea when they first started, and I had one incident when I got up to a higher dose. I think I was doing maybe 40 units or something like that, and within a couple of hours had one episode. But most of the time people struggle with constipation. Weigh every week the same time before you start your day. Don't let people do daily weights and stuff. They get a little obsessive over it. Your weight's going to shift and change a couple of pounds every single day. So we get a good idea of what they're doing over time, once a week, right? And if something doesn't shift, it's usually because one of these things is off, right? So we have a handout for troubleshooting, all the most common things that patients deal with. But they also have to choose a minimum of 3 days a week for physical activity. It needs to be 30 minutes to an hour of some kind of physical activity that is challenging to them at their current fitness level. So if they already work out, 3 days a week, they should maybe work out 3 to 4 days a week, and they need to be pushing themselves to a level that feels physically challenging. If you've got somebody who hasn't exercised in 10 years, they might be starting on walking a mile a day. Maybe that's their exercise, but wherever they're starting, they need to move their body, and it needs to be a habit that's established so that they are continuing to move their body. So when they have lost their weight and they have hit a place that they're happy with, they've titrated their medication off, they're still doing these things so that they don't just swing back into gaining weight again. The goal is, of course, to lose anywhere from 1 to 3 pounds a week. Some weeks are going to be slower. Some weeks are going to be faster. Some weeks you may not see anything shifted at all, but that's why we're titrating the medication about every 2 to 4 weeks, which is how I do it with my patients. If it takes 2 weeks to start to build up to effectiveness in the bloodstream. And generally you'll have some people that are really hungry at week 2. And then you'll have some people that are on, 0.25 milligrams for 4 weeks or 6 weeks or 8 weeks. There is no cookie cutter equation for anybody. I have people that titrate up very, very fast, and at 60 milligrams in 2 months, and I have patients that never ever get to those higher doses. So we titrate our patients every 2 to 4 weeks, depending on how they're doing. So we require a minimum of a 90-day commitment, but most of my patients are really on it for 4 to 6 months. Because once they hit their, if they're oh, I've got 25 pounds to lose, they're going to hit it in 3 months, but most people are going to want to titrate and kind of have a little bit of hand holding. And the way that we do that is you can either cut them down every couple of weeks by half, or what I've actually found that works better for a lot of the patients is to dose every other week over a period of 2 months, or as long as they want to. But we require a minimum of a 90-day commitment. We talk about how, it takes at least 90 days to create new habits, how we reset our set point, semaglutide and tirzepatide are tools to accelerate the weight loss process. It does not replace the need to move. You got to choose good, healthy foods, make consistent, healthy lifestyle choices. They need to lose the weight and learn how to keep it off, and that requires shifts. Those shifts take several months, right? Most people will elect to stay on the program for, 4 to 6 months, sometimes longer. I have some patients that are still on it a year later. They had a lot more weight to lose. People kind of get burned out at a period of time, and they'll kind of like vacillate around, and they'll do really well for a while, and then they'll stay, in that 1.5 pound, 1 pound a week type thing for a while, and then they'll get like back on track, and they'll be super excited, and they'll be back on to that 2 pounds a week or whatever. Some people just struggle, right? So it's consistently reinforcing those things. And they need to sign a contract for expected behavior. If you got a patient that's just not being compliant, go ahead and cut them loose. It's not worth the time or the energy, right? Go home with their medication. They go home with a Sharps container, alcohol pads, copy of their contract, their tips and tricks for success, contact information for me, instructions on, what we're going to follow up with on the weekly stuff, instructions on how to inject and their starting dose, all of that kind of stuff. The thing that you will refill for those patients, now we don't take back their Sharps containers for them. We provide them with their first Sharp container. You can get them from the pharmacies oftentimes, but I make sure that I'm not taking back hundreds of these small Sharps containers, right? So you will be refilling their syringes for them about every 12 weeks, and you may be providing them with extra Sharps containers later on down the road, but they're responsible for their own disposal.